If you have scoliosis, can it be causing your neck pain? When we talk about scoliosis, we understand that scoliosis is a sideways curvature of the spine. And this sideways curvature of the spine can be either in the cervical, thoracic, or lumbar area. And the curve has to measure of 10 degrees or greater with some associated rotation, meaning the spine has to have a turn and a bend in order for it to be called scoliosis. Now, we know scoliosis doesn't just affect the back, meaning when we think of patients of scoliosis, normally people think that it only affects like their thoracic spine or lumbar spine. But like I said, it can also affect their cervical spine. We also know that the spine houses something called your spinal cord, and your skull houses your brain. Now, these two things are something that we call your central nerve system. Your central nerve system are the nerves that control all the systems of your body, but they're also responsible for what you feel in terms of whether you feel pain or numbness or tingling or don't. So therefore, these nerves can also be affected as a result of scoliosis. What surrounds the spine is something called muscles, vessels, and all the nerves and all the ligaments. And when we look at scoliosis, especially as scoliosis gets larger, it can start affecting the muscles and vessels and nerves and ligaments, and it can start affecting the way these nerves function, which can complicate what the effects of scoliosis is. As scoliosis get more severe, they also start to affect functional issues like possible lung issues, digestive issues, and other functional concerns that can happen in the body as a result of either the size of curve or affecting the central nerve system, which can lead to the neurological effects within the body. So does scoliosis affect your neck, and can it cause neck pain? Well, we know scoliosis curves can occur all the way up into the neck, but even scolioses that are diagnosed as more in the thoracic spine or lumbar spine can affect other patterns of the spine, meaning scoliosis is not just a two-dimensional shifting or curve, it's a three-dimensional shift. So not only can it affect the front view, but it can also affect the side view. And typically, when it starts causing problems, it starts creating most commonly a stiffness or sore type of feeling. So most patients feel stiffness or soreness. They can feel stiffness and soreness in the neck. They can feel it in the shoulders, in the upper back. They feel like this loss of flexibility or this lack of range of motion tends to be the number one symptom as a result of scoliosis. And it can be in the neck, it can be in the mid-back, and it can be in the low back. In addition, when scoliosis start to affect the cervical spine in particularly, not only can it affect the motion or the flexibility of the spine, but if it starts to affect the nerve tissue, it can start causing numbness into the arms and shoulders and legs. You can start getting some radiating pain into the fingers. You can lead to other issues that radiate away from the spine. But normally, the number one or the initial complaint is rigidity, and especially as the curves progress. Because we know scoliosis can affect the other dimension of the spine, which is the side view, it can start affecting the normal curves that you're supposed to have. So we know scoliosis is a sideways curvature of the spine, but we know when scoliosis starts to affect the spine, it can affect the side view. And it can lead to something that they call a military neck or a straight neck or something called the cervical kyphosis. These is when you lose the normal cervical curve of the spine. And in addition, we normally start getting something called forward head posture. Your head starts to move forward relative to your torso, and the neck starts becoming extremely straight. Then when this loses its normal position, it has the same effect that scoliosis would have, meaning having a curvature in the neck. And it starts affecting the central nerve system, can start affecting the nerves, the ligaments, the muscles, the tissues, the vessels in those areas, which can also lead to stiffness and pain. When we start affecting the neck position in the side view and as well as the front view, it can start leading to other issues, like I mentioned, not only radiating down into the arm, but it can also be one of the causes of headaches. And these headaches tend to be tension headaches that come from the cervical spine. They tend to lead up into the neck as a result of strained or tight muscles. It can also affect the cerebrospinal fluid that surrounds the brain and the way it transmits up into the brain, so the brain doesn't get the nourishment it needs, and therefore it can lead to some headaches along that line. It can also start developing into migraine headaches as a result of this, because the lack of blood flow going up into the brain system associated with the cerebrospinal fluid. This can affect the pressure on the brain and make you have this headache-like feeling. So scoliosis can lead to many different issues in the upper part of the body: neck, head, brain, shoulders, arms. So even though these symptoms can be a result of the scoliosis, most patients, when they start seeking treatment, they start seeking treatment for the symptoms and specifically, meaning, can I help something with my headaches? Can I help something with my neck pain? Can I help something with my shoulder or my arm pain? And a lot of these symptoms are treated with like pain management, like either medications or injections. And even though they may get help with what they're feeling, they're not addressing the underlying cause of the problem, which could be the misalignments that are associated with the scoliosis and the loss of normal curvature in the neck. If you don't address the underlying cause and you just continue to treat the symptoms that are associated with it, normally what you'll tend to see is your problems continue to progress and you don't get the results that you really want, which tend to be long-lasting results. So what we recommend is if you address the cause, which is what's truly causing the problem, which is the misalignments of the spine, the scoliosis, the loss of curvatures, this type of treatment can have a long-lasting result. And most importantly, it's proactive, meaning it's going to stop the curve from worsening over time, which will lead to further problems as your curves continue to progress. So we recommend reducing the cause of the problem and being proactive so your curves don't continue to worsen and cause more problems. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.